Hello everyone, this is Yalda from Eat, Burn, Sleep, the online low inflammation, gut health and sustained weight loss platform. If you follow me on my social media, you probably know that I love learning, discovering new things, meeting passionate individuals. So I have decided to launch this podcast where I interview amazing people. We're going to be talking about physical health, mental health, well-being, with people who are passionate about what they do and who strive for excellence. I hope you learn from it and you enjoy it. Let's get started. Hello everyone, welcome back to another episode of the Eat, Burn, Sleep podcast. I'm here today with an incredible woman, Tamsin Lewis, who's a medical doctor specializing in integrative medicine. Tamsin, you have so many achievements. There are so many things that you focus on. I think I would love you to tell us a little bit more about your journey, what you have done in the past, what you're doing now before we kick off this conversation.
Thank you, Yalda. It's so nice to be here in this really crazy time that's sort of hopefully coming out the other end of now, but in a very different way to what we knew before. So, I'm a medical doctor. I trained at King's College in London and then Guy's and St Thomas's hospitals. I integrated a Bachelor of Science in Neuroscience and the biology of aging. So, was really early on, was very interested in how we age, why we age, and looking at the pathways involved in that. When I qualified, I spent time as a junior doctor, which was very difficult. And in my final year of med school, I had this head injury, which basically changed the course of my life. It was a skiing accident, and I was in a induced coma for 3 days in Canada, hit my head. And the sequelae from that really changed the way I approach medicine, or did on reflection, because a lot of the conventional ways of dealing with inflammation, which was essentially caused by this head injury, the massive shock to my brain, really wasn't up to scratch. So we'll come back to that. But my journey then became, I actually took a course into psychiatry because I felt that it afforded me the opportunity to really have time with patients. Whereas on the wards, we were very much rushing from one to the next, looking at the charts and really not looking at the human behind the chart. And that started to disturb me a bit. So I trained in psychiatry, did the membership of the Royal College. And towards the end of that training, I was doing a little bit more in the way of triathlon, which I took up because my boyfriend at the time was very good at it. And I wasn't. I was, really not that healthy. I was, healthy enough, but I was drinking and occasionally smoking and eating, living on Diet Coke and bagels. And we split up and I decided I'd do a triathlon finally, and I discovered I was quite good at it. Long story short, I got picked for the Great Britain team. What's about 20, just before. It was quite a long journey, a few years, but I have a sports gene. My dad was a pro cyclist and is tough as old boots, and a part of that was mental resilience going into triathlon. So I found my way into the world of professional sport very much as later on. And I learnt through that journey, I started to shift my lens over disease and dysfunction into possibility and potential, and discovered that we could actually, by doing all this different functional integrative tests, a lot deeper than your standard tests, we could actually work out the cause of not feeling great or not performing great or not having energy. And that was a chap called Ben Greenfield, who I came across in the world of triathlon, who you may know. And I started to open my eyes a bit more and essentially set up a company that tested people's blood for biomarkers that we know influence performance, fatigue, libido, sleep. And then through that journey got into functional medicine. So looking really at, root cause of disease and autoimmune disease and the impact of stress on the body and how we could modify that course. And essentially, I still work in that today in a company which I founded called Wellgevity, which is trying to bring health span to people through whatever means that is, whatever necessary means that is for them. And that's a very personalized approach because we all have different drivers of disease and dysfunction. Yeah.
So before we talk about anything medicine related, I just want to say how impressive you are.
Oh, bless you.
And it's so inspiring.
You forget, don't you? When you wake up and you've got bags under your eyes, you're like, huh? What am I today?
You should listen to this every day. If there's any day you don't feel good, play the podcast and listen to all your achievements. So not only you're beautiful, but extremely intelligent, hard worker. You put yourself in question. You were on a ward and you questioned yourself thinking, I'm just looking at the charts here. Let's deepen it. Let's go into psychiatry. And you studied neuroscience, which in itself is an incredible achievement. It's one of my new favorite topics. And you're an accomplished sportswoman, and a mum. So,
perfectionist mindset. We'll come to that and why that's got its limits as well, as you know.
It does. I've actually filmed a masterclass on this on the platform because I did suffer from that and I work on it. Done is better than perfect, and perfectionism is not a great thing. But in the meantime, you have achieved incredible things, and it's so important when I meet men and women who have done all the things you do. It's just so beautiful because you think that your passage on this planet, you've done your bit. You're so far, you've worked so hard to help others to understand more, to push yourself, to try the best you can with what was given to you. And just for that, I admire you. I think it's extraordinary.
Thank you.
Well done.
I think what drives me is that ability to not let people suffer the way that I did from, doctors or people not figuring stuff out or being too reductionist and blindsided in their approach. And, we were taught in med school that it was this way and we followed this pathway. And really the out of the box thinking wasn't encouraged. And that didn't make sense to me because there were these academics and we were looking at all these papers about exploring different pathways. And then actually when you come to the medicine, it's like, well, it's this and go down that pathway. And people don't fit into boxes. And so I really like to kind of try and open up doors to people for their own learning so that they can go on a path where that they can, be a better version of themselves and not to be driven down into some diagnostic category that then changes the rest of their life because they associate with that.
Absolutely. Absolutely. I mean, I have experienced that as a patient myself, and I come from the same, that really resonates with me because I come from the same school of thought where I'm hoping to help people so they have an alternative to what there is out there. Of course, we need doctors, we need hospitals, they save lives every day, but there is a limitation to the way of thinking and to the current way things are done. The beauty is I see an increasing number of people like you who are trained in medical schools and say, hold on, there is a third way. It's not black and white. There is the way where I can use all my knowledge, deepen it, and complete it with extra things, more holistic or testing like you do. So tell us a little bit about these tests that you do and the biomarkers. How do you measure aging, risk of disease, risk of mental health issues? How do you measure all these things?
I think that's a very good question. It's very complex, and obviously one individual can't do it all. I work with a team, I work with other practitioners, but I think it's very much, it's time and communication with the individual. I think that really creates the map of understanding someone and knowing which direction they're best off going in. Because for some people it's quite obvious they've got, I work alongside a patient's GP, it can be quite obvious that they're overweight, diabetic, smoking, or it can be more subtle that, they've had long-standing depression or anxiety or insomnia, and the GP is just medicating, and people are like, well, I feel kind of numb, but I don't feel like I'm thriving. And sometimes we'll try and pick that apart, and that can be psychological work. It can be, using other means to restore nervous system function, which we'll go into, like breath work, more meditative practice, yoga, and even plant medicine sometimes. But for some people, there can be biological drivers to mental health problems, like, vitamin B12 deficiencies or iron deficiency or magnesium, all of these things, and even fatty acids, all of the stuff that you talk about with Eat, Plan, Sleep. It's, all of these are drivers to dysfunction, which can, in vulnerable people or in genetically vulnerable or genetically predisposed people, reflect itself as depression, anxiety, insomnia, whatever that is, that symptom. You can improve it by looking a bit deeper. Mm-hmm. And that can be gut health too, which is related obviously to the diet, but also related to, there can be overt bugs in the gut. Like for some people, they've had parasites for X, Y, Z years. We don't know. My own experience, swimming in horrible types of water, and but that's not diagnosed via a GP. He'll just sign you off. She might sign you off as IBS, and you might have an IBS diagnosis, irritable bowel, all your life, without actually looking at, can we fix this?
Interesting. Yeah.
Can we kill the bad stuff, get some good stuff in, reduce inflammation, and get the gut working better? Getting the motility working, so the balance in the gut is important. So I look at all the aspects. I'll do a blood test, a gut test. Sometimes I'll take into account genetics. Although, a lot of genetics is potentially more modifiable than we thought, and some of the consumer genetic tests are a bit over-publicized, popularized. And then in terms of rate of aging, we can look at epigenetics. So we can look at these little methylation markers that sit on your DNA and turn on certain genes. And depending on how many of those groups you have, that's a sign that your biological age might be over your chronological age. And that is a saliva test. It's called an epigenetic test. I work with a company separately who are trying to scale this approach called Humanity. And they're in alpha stage now, but they're going to be doing, they're an app-based company. They'll do a small blood test and this epigenetic test, and then they'll take in wearable data like your Fitbit, your Oura Ring, whatever. They'll take in your food from whatever, if you can self-enter it or take pictures. They'll take in your activity, your sleep, and then they'll look at what people are doing at the same age and demographic that's working in terms of reducing the rate of biological age, and then they'll feed that into you. So that's an interesting field. Mm-hmm. Really crowdsourcing what's working for what we know to be the healthiest people.
Interesting. Mm. Yeah, I talk about epigenetics quite a bit because obviously your lifestyle does switch on or off your genes, your weak genes. And I'm the living proof of that.
Yeah, for sure.
The day I start cheating, I have symptoms and my weaker genes get fired up.
Yeah.
If I have more chronic inflammation or if I'm stressed. And talking about stress, there is something you mentioned earlier before we started recording. You spoke about trauma medicine and all the traumas that have been brought up since the start of the pandemic, in the sense that people have been looking at themselves more, they've been doing more introspection, and that which has brought up old traumas. Sure. So tell us a bit more about this and how you have been helping people resolve those issues.
Sure. Well, I think, as I said when we first started, COVID has brought in, or this whole pandemic has destabilized the world in which we know it. And there's been a huge amount of uncertainty. And if there's anything the human can't cope with in terms of, or copes less well with in terms of situations, it's uncertainty. The worst thing about being tortured is uncertainty. You kind of want to know one way, is it going to go one way or another? But so that causes a lot of stress in individuals, and which is, then compounded by the fact that we are forced into smaller environments. We've been having less of our coping strategies. We haven't been able to go out. We haven't been able to socialize. We, can't effectively hug people, which is a big calming source of calming for the nervous system. So people have been really forced into these, these unnatural environments, and it's really destabilized people. And that can be reflected in an increased rate of depression, anxiety, eating disorders, weight gain in some people because, goodness, it's hard to stay motivated when you're locked up, the weather's bad. So I think it's that. And I also think for the people like me who have had COVID, it was literally like a bomb, not just physically, but mentally, because of and you know how scary this is when something happens to your body that you don't feel in control of, or you can't seem to control, you can't seem to regulate it. You're forced to really draw on every resource that you have, and every resilience tactic to keep going, and that for many people is family or support of friends, even if it's over the phone, and it's having a medical system that you trust. I think COVID was a double whammy because we didn't know how to treat it. The news was showing people dying every 5 seconds. So that activates that huge fight and flight, that sympathetic nervous system, which triggers inflammation. And I know you talk a lot about inflammation. It can be manifested in the body in so many different ways, inflammation. But all the stress hormones trigger inflammation in the body, and that can cause joint pain. It can cause allergies. It can cause it can trigger autoimmune issues like you had. We know now that long COVID is thought to be some form of an autoimmune disease. Your body starts to, the virus triggers the release of a lot of immune cells that attack the body, all of the systems. My heart, my lungs, my knees, my joints, everything was affected, and probably the brain, because there were times when your mood was really, really low, and there's a lot of people struggling similarly. So I think it's forced us as a medical profession to really try and rethink what really happens when something goes on, because COVID is a systemic problem, and we are very reductionist in medicine. We look at the cardiologists, the urologists, neurologists, but COVID has caused things everywhere. So the people that have really done well in treating it are the people that are the physicians that understand systemic disease. I think we talked initially about this whole concept of trauma, and people, when you ask, especially the very outwardly strong people, I've not really had any trauma, because we think of trauma as being shot at, or having a really close someone that we're close to die. But trauma, as Gabor Mate talks about, isn't so much what happens to you, it's what happens in you. So it's how your body responds to whatever the situational event was. And that can be, it can be, relationship breakdown. It can be, some abusive relationship with your parents when you were young. It can be all sorts of things. So I think it's really important to really start opening this discussion as to how do we actually start healing that trauma. And often that isn't talking about it. It's finding a way to be okay within yourself, to regulate yourself, and to really let it in, let it be, let it go, as we say. So we'll come to that.
Very, very interesting. And I'm not surprised it does affect the mood, because brain cells do get inflamed. Depression, Alzheimer's, Parkinson's are all linked to chronic inflammation. So I guess, we can see, for example, for me, the best example is a hangover. When you're hungover, you're super inflamed and your mood is very low. It's the best way of seeing how the brain gets inflamed and how
shrunk. That's the whole point, right?
You're brain dead for a day because you've poisoned yourself with alcohol, which is super inflammatory. That is very interesting indeed. And what's your vision in terms of how the medical system is going to respond to people with long COVID? Because once we contain the virus, once a vaccine that everyone feels comfortable with is rolled out and people take it, there will be all those people who would have caught the virus and will live with long COVID. How do you think that will be treated with in the long run?
I think, already it's sort of 10 months down the line for me, and it was, month on month there's general improvements, but, there are, an estimated 1 million people in the UK that have long COVID right now. So, that's huge. And that the range of symptoms are, a bit like chronic fatigue, which has seen chronic fatigue syndrome like ME, which has seen a resurgence recently of people looking at how to deal with it because, you're just palmed off with it. But I think what it's forcing the medical system to do is bring together psychological approaches, nutritional approaches, exercise approaches, and then the diagnostics. So really looking, is there organ damage here? Because for some people there really is. And some people are having raised blood pressure. Some people are developing what they call POTS, which is postural orthostatic tachycardia syndrome, which is an autoimmune disease. God. And that essentially means you don't retain your blood pressure. So from sit to standing, you can feel very faint, and there's very little exercise tolerance. So
yes, well, there are a lot of so the exercise tolerance. I used to suffer from that until I realized that some workouts are actually anti-inflammatory. There's a way, because there's a link between core strength, gut health, and inflammation, because the vagus nerve links the spine to the gastrointestinal tract. And through those workouts, so I was like you, I used to love intense things. I used to run a lot. I used to live in Mayfair and work in Canary Wharf, and I would jog.
Yeah.
I would start working at 6:30 in the morning in foreign exchange on the trading floor. And during the summer, a couple of times a week, I would jog to work, which was, when I think about it, crazy. But I really enjoyed the endorphin high you get from running. However, once I started having my autoimmune issues and I had so much chronic inflammation running through my body, jogging or lifting weights or anything remotely intense made me so sick, and I was wiped out. 2 days in bed every time I would see my personal trainer. Yeah. And so I have developed these workouts which I share. So I will be giving you access to the platform so you can deal with your long COVID.
I think that's a message for everyone, right? Because in our late 20s, early 30s, we dig holes that then, it's very hard to get out of. And when you hit 40, I used to not believe this, because I used to have this ridiculous view that, I'm an athlete and I'm resilient and I'm never going to have all these things and it's not me. And then you realize that actually no one escapes the impact of stress. And getting up at 5 a.m. and running to work, even though we know exercise is good for us, is stressful.
Absolutely.
Working on a trading floor is stressful. Having a-hole ex-husband is stressful. All of these things compound together to show you that you really need to take care of yourselves more in your 30s. I think being aware is hugely important, and I would definitely revise my life.
Absolutely.
If I had it again.
But you live and you learn. So we learn. Also, coming back to intense exercise, if it was so good for us, all sportsmen would live until they're 100. And you work on longevity, you know that it is not the case.
No.
Because intense exercise is extreme, and the body doesn't like extreme things.
Yeah, I was thinking about that because there's a TED talk called Run for Your Life, but not too far or too fast. And I used, my own father, who was Tour de France completer, the big cycle race British champion, he's 74 and has vascular dementia, which is classic. And he can't remember what he did 5 minutes ago, but he can still ride a bike up a hill. But that is all oxidative stress.
Correct.
That is inflammation. His uric acid levels, he has gout, another massively inflammatory disease. So even though he's fit, he's definitely overdone it for years. And, I don't think we should herald those extremes anymore without acknowledging that there is long-term damage, unless you then revise your way of living.
Correct.
So I think that's worth flagging up.
Absolutely. I'm so glad you're saying this. Interestingly, my dad is 76 and has been a great role model for me, in the sense that he wasn't the typical Persian dad eating all the food, and he has always been someone quite healthy. So from a young age, he would always teach me to, have more fruit, more vegetables. Yalda, you don't need that much rice, maybe have more veggies, but in a very gentle manner. When my mom would make me finish my plate, my dad once said to me, Yalda, if you're full, stop eating. And it was a light bulb moment in my head. I was 15 years old. He has exercised every single day of his life, but in a moderate manner. He plays tennis, which he loves, and he runs, but he jogs slowly. He's 76, touch wood, and in top form. Also, he doesn't drink coffee, so he's the king of moderation, but to the point of, sorry, Papa, almost boring. But it's a great example.
Yeah, I mean, it's so true. It's actually boring. The body does not like extremes, and it's if you do extremes, just accept that there needs to be a damage limitation protocol built around it.
Correct.
And that's what I learn a lot more now, because that endorphin impact. If I've won races, and I sometimes can't sort of. I crave that feeling of going across the finish line and, feeling more alive than you've ever felt.
And you have dopamine, you have everything running through you. Yes.
And nothing beats that. But I think, I just think it's all about moderation, like you say. If you're doing one endurance event a year rather than 10,
Correct. Exactly. And it's all about what your body can cope with. So, for example, pre-COVID, you could cope with more intense training than post. So, for example, sometimes I have some people who join my platform and they used to work out intensely 5 times a week. And they say to me, oh my God, Yelda, do I have to stop completely? I always say it's all about where you start. No, you don't have to. If you go down to twice a week or once a week, that will lower your inflammation because your body is so used to it. You don't have to put a stop to it, but just vary your exercise with things that are more moderate. And if you really crave the endorphin high, do that once a week as a treat.
And judge how you feel the day after. That's why I like using things like the Aura Ring or the Whoop Band, because it gives you sort of an objective. And if you're in tune with yourself, you can feel this. I can feel if I'm not recovered, I'm achy, my heart rate's a little bit increased in the morning. And COVID, given that it's an inflammatory disease, has just augmented that. I never used to if you're feeling achy, heavy, really not good 4 hours after a session, then it's not right, 4 or 5 hours. So, really opening yourself up. I've been more of a yogi this year than I've ever been in my life, and it's so nice to be flexible. I ran for the train this morning and was, out of breath, which is totally what I'm not used to. I'm like, oh my God, how times have changed. But, meet your bodies where it's at and note that it needs to be this sort of sweet spot between a little bit of stress, a little bit of, stimulus so that your body adapts and changes, and then this sort of withdrawing, retreating recovery. And that's nutritional. It's being kind to yourself. And if anything, what you're trying to encourage on this platform is a sense of, support and being kind and not punish, not the insanity workouts, really just make your body, bring yourself back to safety, because the body functions better there.
No pain, no gain is the worst motto ever. Just be nice to yourselves, people.
Yeah, I mean, a little bit of stress, is this kind of concept of hormesis, which is, that you adapt and strengthen to a trigger, but too much is just going to break you down.
Yeah, we need a bit of stimulus, as you said. In the morning, your cortisol levels are higher because it makes you go and get things. But it's good up to a certain point. So, very interesting. If people want to find you, Tamsin, where can they go?
So I am on social media. I'm intermittent with it because it takes a lot of time, as you know, and I have a day job at Sporty Docs. That's Sport IE DOC. The website for the company is Wellgevity, but I am going to be doing a bit more.
Is it wellgevity.co.uk?
Or .com, both.
Okay.
Yeah.
Brilliant.
I got the .com, thank goodness. And we'll be doing a little bit more with that in the in 2021.
Well,
which will be exciting.
We all look forward to it. Thank you very much for being my guest.
It's lovely to be here. Yeah.
I really enjoyed this talk. You're so fascinating. To everyone listening to this, please go and check out Tamsin's work. If you're based in London and you want to meet her, reach out to her through social media or through her website, wellgevity.com. I will be linking all of this with the podcast. Thank you very much for listening. Make sure to rate, review, share this podcast with anyone who might listen to it and enjoy it. Tamsin, thank you so much for being my guest today. Thank you to all of you for listening today. I hope you enjoyed it. Feel free to go on eatburnsleep.com to learn more about gut health and chronic inflammation. I would really appreciate if you could rate this podcast, and of course feel free to share it with anyone who might enjoy it. Have a beautiful day.